There are now a total of 16 election workers in Henrico and Richmond that have COVID-19, and the health director for both says it may be that not following that critical 6 feet of distance is to blame.
With 90% of the Richmond Registrar's office under quarantine after 11 employees tested positive for COVID-19 and a member of Mayor LeVar Stoney's campaign staff sick with the virus after spending time in the Registrar's office, Stoney held a virtual press conference.
Personally, I'm feeling very well.
The mayor is currently in isolation due to contact with his campaign staffer that has COVID. Stoney says he is one of 57 employees in the city currently in quarantine due to possible COVID exposure. 37 of them are with the Richmond Police Department.
Currently, there are 25 confirmed positive cases within the city of Richmond's workforce.
The head of the Richmond and Henrico Health Districts, Dr. Danny Avula, says those 25 confirmed positive cases and the employees in quarantine are not all tied to the registrar's office. He says it appears all employees in the Richmond Registrar's office wore masks while working the election. However, some other safety protocols may not have been followed.
But also, we consistently heard stories that people were not able to be fully physically distanced at 6 feet.
He also said his staff found employees who had mild symptoms they thought were fall allergies and still came to work.
You know, that story is heard over and over almost every day as we're working up clusters where people don't recognize that even mild symptoms like congestion and runny nose are symptoms of COVID.
Meanwhile, across the border in Henrico, 5 employees at the registrar's office there have now tested positive for COVID-19. Henrico's deputy county manager for public safety, Tony McDowell, told me 2 of the 5 have symptoms. He said their epidemiologists are looking into how the spread occurred, adding that the disease is highly contagious. And even with all the right protections and safeguards in place, there is still a risk of infection.
Masks are one of the most effective ways to prevent the transmission of COVID, but they by themselves aren't 100% effective, which is why we talk about really needing to use all of the things that work. So mask wearing is incredibly important, but so is maintaining physical distancing.
Now, Dr. Avula is recommending that everyone take the time to go to the CDC website and look over what the symptoms of COVID-19 are again. So even if you have just very mild symptoms that you think might be allergies, he's urging you to stay home, get tested before you go back out and interact with others.